The line began forming 20 hours before the doors were scheduled to open. Residents of the Bay Area, eager to be the first in line to receive free medical and dental services, spent the night anticipating relief with the coming of the dawn. They came with pain. They came with questions. They came to bring a friend or relative in desperate need. By the time the doors opened, thousands had gathered in both San Francisco and Oakland, California, for the Bridges to Health medical and dental clinics, which promised free-of-charge services on a first-come, first-served basis. Organized by the Western U.S. chapter of Adventist Services and Industries, or ASI, the unprecedented event included the involvement and partnership of the Seventh-day Adventist Church in both Central and Northern California, the church's Pacific Area Union headquarters, the office of the mayor in both San Francisco and Oakland, the Department of Health, and other civic ministry and health-related organizations. Over a 3-day period, close to 500 healthcare professionals and volunteer staff worked tirelessly to provide dozens of medical and dental services to close to 3,000 local residents. Volunteers, most of whom are members of the Seventh-day Adventist Church, came from all parts of North America, some even from as far as Saudi Arabia, driven by a spirit of service and the desire to meet the tangible needs of those who would come. The clinics were organized into specific service areas, each with its team of specialized healthcare professionals and trained volunteers. Patients were registered, triaged efficiently, and escorted to the proper area by hospitality volunteers. Waiting areas were set up near each service area as patients awaited personalized care. The services offered were comprehensive by any standards, considering that the clinics were housed in multi-purpose venues. Using high-end technology, highly skilled dental professionals provided crowns, fillings, extractions, cleanings, and necessary root canals. Meanwhile, on-site technicians ensured that the equipment was well maintained and available at all times. Close by, patients received eye care services, including vision testing and free glasses. One patient, with tears in her eyes, explained how she would no longer need the large magnifying glass she had carried around in order to read. In yet another area, residents were able to visit one-on-one with primary care physicians, who consulted with patients and diagnosed a number of concerns. Specialized medical services were also available, including pediatrics, OBGYN, STD and HIV screening, medical massage, physical therapy, X-rays, and laboratory services. Perhaps the most dramatic example of the diversity of services offered was the general surgery, including an operation performed on a patient in order to take out a lipoma the size of a grapefruit. And yet it seemed by the event organizers, led by ASI's Dr. Leila Lewis, that the Bridges to Health experience could and should be even broader. In addition to personalized and professional health care, patients were offered a variety of live musical performances as they waited. School choirs, smaller ensembles, solos, and instrumentals filled the venues as Bay Area residents awaited treatment. Patients also had the opportunity to take advantage of chaplaincy services, and those who were there over lunchtime were offered a free nutritious meal. In the end, over $5 million in health care was given to nearly 3,000 residents of the Bay Area by close to 500 service-oriented professionals and staff. Those could and should be considered tremendously successful results. And yet perhaps the greater results are the intangible ones, the effects in the lives of those who returned home and to their communities with less pain and more hope. And that is a purpose worth pursuing and a story worth telling.